2.
Good morning, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health, and Tim Beckett, our Fire Chief and Director of Emergency Management. I want to start off by recognizing that it is Customer Service Week, and there's no better time to thank the hardworking staff who are really the face of our city, from 311 to My Way and our transit drivers and operators, parks and facilities, works, recreation enforcement, bylaw, and more, for stepping up since the onset of this pandemic to keep our city running and to ensure that residents continue to have access to the services that they rely on each and every day. I can't tell you how many emails, texts, and notes I've received from residents who are thankful for the work that our frontline workers are doing. You are making us proud and confirming what many of us already know. Mississauga is truly the envy of the GTHA. As we approach Thanksgiving, Peel is currently averaging 60 to 100 cases a day, with an average of 46 new cases in Mississauga. The last time we saw these numbers this high was back in early June. While none of us want to see cases creep up again, the good news is that our numbers here in Peel have remained relatively stable over the past month. But we know that this can change at any moment. It just takes one lapse to push us into a second wave. That's why listening to the advice of public health professionals at all times, but especially this Thanksgiving, is so very important, and I cannot stress this enough. It is time to stop the spread. Easter, Eid, Rosh Hashanah, Vesak, and now Thanksgiving. They weren't the holidays we had hoped for, surrounded by our family and friends. But if we don't do the right thing right here and right now, we're also putting at risk Diwali, Christmas, Hanukkah, and Kwanzaa on the line. The best way to stay safe and be thankful for this year is by keeping your gatherings to your immediate household for your essential supports. If you insist that your extended family must be involved, we ask you to please consider celebrating virtually or taking it outside. I cannot emphasize this enough. The best way to keep your family and friends safe this year is to stick to your immediate households. Period. Full stop. As I've said many times before, only we can move the virus, and only we can stop it. This is a small sacrifice for the greater good, and I encourage all Mississaugans to please work together and listen to the advice of health professionals. They know what they're talking about. They've guided us through this pandemic, and they will continue to do so as we navigate the fall season and beyond. The vast majority, over 80% of cases here in Peel, have been successfully traced, and right now we are not seeing transmissions linked to retail, to gyms, to bars, or to restaurants. However, if we're not extremely careful, that could change at any time. Weddings and social functions at banquet halls, small get-togethers with family and friends, and gatherings at places of worship continue to be hot spots, with those infected and bringing them home to their families. While I don't want to see businesses negatively impacted, I do want to thank the Premier for taking action to limit the capacity in banquet halls to 50, as these settings have been the cause of concern in terms of transmission here in the region of Peel. On that note, we continue to keep an eye on what is happening in neighbourhood cities like Toronto, because we are acutely aware of our proximity and the impact that any closures or any further restrictions might have right here in Mississauga. I cannot stress this enough. At this time, we are not seeing transmissions in bars, restaurants, lounges, or gyms here in Peel. While there have been some cases linked to workplaces, for the most part, they have not been public-facing businesses. And for that very reason, I have stressed with the Premier that I don't think that any further restrictions or business closures are warranted or needed here in Mississauga at this time. I plan on reiterating that message during my call with the Prime Minister this afternoon. The measures that the province has put in place, from limiting the size of public gatherings to reducing the indoor capacity at bars, restaurants, and event facilities, adequately address our concerns here in Peel at this time. Peel's challenges are different than those of Toronto's and are also different from those of Ottawa. It is important that our actions and responses reflect our distinct realities. Should the movement and the spread of the virus change or evolve, I know Dr. Lowe will be prepared and ready to respond accordingly. I want to once again take the opportunity to thank our business community, the overwhelming majority who have been abiding by the health and safety guidelines and are doing everything in their power to keep COVID out of their businesses and keep their customers and their employees safe. We ask our residents to please do their part to keep our economy running by shrinking their bubbles to only the most essential people in their lives. Think twice before going out. And don't feel bad about not accepting an invitation for a night out, to a friend's wedding or a dinner party, or even with the family. While sometimes it doesn't feel like it, they will understand. It'll take all of us to make personal sacrifices to reduce the spread. A small investment now will have big returns in the future. And now, I will invite Dr. Lowe up to provide us with his weekly update. Dr. Lowe?
Thank you, Madam Mayor, and good morning. As of yesterday, Peel Public Health has investigated 4,029 cases of COVID-19 in the city of Mississauga, 345 active, 3,452 resolved, and 232 deceased. Understanding community context is the fundamental role and expertise of local public health units. And I know that there have been questions around our picture in Peel. At its most basic, a wave is defined by a number of cases. However, other classic epidemiologic criteria to define a wave include how quickly cases are rising and where transmission is occurring. I've been asked why Ontario is in a second wave while Peel's cases remain high and on a seeming precipice. It's important to remember that the picture of large jurisdictions always reflects many different local situations put together. Right now, for example, the United States is still deep in its first wave, while New York City is long done with its first. At the same time, our provincial partners who run testing continue to clear a significant testing backlog. This leaves me concerned that we will see even more dramatic fluctuations in our daily case counts in the weeks to come. So let me state this very clearly. Peel continues to see high, consistent levels of transmission. And while these are mostly within known chains, that can change at any moment. That means it is less important to focus on what to call our current situation and more important to talk about what we can do to protect ourselves and to protect each other. We are seeing spread in large workplaces where remote work is not possible. The settings without precautions have become havens for viral spreads. Think factories, manufacturing plants, and warehouses. We continue to see significant household transmission. And most relevant to this weekend, one of our major drivers has been social gatherings, ranging from small in-home get-togethers to large celebrations like weddings. Peel's patterns reflect our community's makeup. We have larger suburban homes with families and more occupants. We have a lot more in-home get-togethers. And we have lots of big workplaces that keep Canada moving. That means, with Thanksgiving coming, we must change how we interact, lest we see spread into the wider community, or worse, into at-risk settings like seniors' homes and schools. So it is up to all of us to stop transmission and interrupt the cycle from work to home to social gatherings. So I make the following recommendations. First, I know many Mississaugans and Peel residents work and visit in Toronto. Given the resurgence that has been observed in that city, I urge you to follow the recommendations of my counterpart, Dr. Eileen de Villa, in the city, and limit any visits there to essential reasons, which I define as work, education, exercise and fitness, healthcare services, and the purchase of food and drink, gas, and auto maintenance. Secondly, wherever possible, I urge you to do the same in Peel, to limit and reduce your in-person contacts as much as possible. We should limit our close contacts, the people who we are within 2 meters with, to our household and essential supports as much as possible. And for all other non-essential and discretionary in-person interactions, I urge you to postpone, cancel, or visit virtually. And if you must meet in person, beyond your household and essential supports, less is more. No large gatherings. Keep numbers low. Prefer the outdoors, though that's not always a guarantee. And always practice the core 4 precautions of distancing, masking, hand washing, and canceling if you're sick. This advice especially applies to Thanksgiving. Your Thanksgiving gathering should be as small as possible and ideally limited to your immediate household and those essential supports. Now's not the time to come home from school. Now's the time to reconsider any large celebrations. I urge you to consider seeing extended family virtually. I know this may be disappointing, but we must keep things under control here in Peel, and we must continue to drive our caseloads further down. The broad community spread that is seen in Toronto and Ottawa and elsewhere could very quickly become our picture if we are not careful. So let's do the right thing this holiday, and let's keep Thanksgiving small. Thank you very much, and I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe. Before I close, I'd like to take the opportunity to invite residents to participate in our 2021 Budget Teletown Hall tonight at 7 p.m. This year's budget will be particularly important as we work to recover from COVID-19 and build back to better. I want to assure residents that we're doing everything we can in our power to design a budget that is balanced, keeps taxes competitive, and keeps services running and minimizes any impact to the taxpayer. To find out more or for more information, please visit mississauga.ca/budget. So once again, please have a happy but safe Thanksgiving, Mississauga. I know this is not the way that we imagine celebrating, but please listen to the advice of our top doctors and keep your dinner to your immediate household and your essential supports only. Like many of you, I'd like to rewrite 2020 and start over again. But this year has taught us many things, and it's taught us one thing. It is that when we come together as a city, a province, and a country, we can overcome any challenges before us. So please stay strong, stay well, and we will get through this together. And now I would welcome any questions from the media. Thank you.
Mayor Crombie, your first question comes from Ashley Newport from Mississauga. Ashley, please go ahead.
Morning, Ashley.
Good morning. So my first question is actually about Halloween. I know that now the city has put out formal recommendations for Thanksgiving, and Halloween is coming up a little less than a month from now. So I'm wondering if the city and region are planning on putting out any formal recommendations about Halloween, and if the city actually would have the authority to say, like, ban or fine people for trick-or-treating if they don't think it's safe, or how you plan to handle that holiday at the end of the month.
Well, thank you for the important question, Ashley. I think we'll get through Thanksgiving and then plan Halloween. However, we know how much the children enjoy dressing up and collecting candy, and we will come out with some guidelines on how to do so safely. I will invite Dr. Lowe to the podiums, and perhaps he's got a few more ideas on how the children can continue to celebrate Halloween and get dressed up, but do the collection of candy in a very safe way this year during COVID. Dr. Lowe?
Yes. Thank you, Mayor Crombie. Thank you, Ashley, for the question. So Halloween, in the way it is celebrated, is probably one of the most unique holidays on the calendar. As you know, it typically involves trick-or-treating. And at this time, the province is heavily looking at the question of how we can celebrate Halloween safely and under what conditions or contexts certain aspects of traditional celebrations might be changed or curtailed. So while I don't have any information for you just at this time, because the guidance and the recommendation continues to be actively discussed, we are hoping to be able to release something that both recognizes the unique nature of the celebration as compared to many other holidays, and also continues to keep our community safe. Thanks very much for the question.
Next question.
So actually, my next question is probably for Dr. Lowe as well. But
no problem. Sure, kick it off.
So I know that the situation in Peel, you and Dr. Lowe have talked a lot about how you're seeing the majority of the spread, it seems, private gatherings and workplaces. With so much spread in workplaces, I'm wondering if there's any sort of initiative or program underway, or maybe this is already happening, where Peel Public Health is able to kind of randomly inspect workplaces to see if they're complying with masking or with distancing or with proper safety. Is anything being done on Peel's end to try to catch these workplaces and make changes to them before these big outbreaks happen?
Sure. Let me kick that off, then I'll invite Dr. Lowe to the podium. So certainly in Peel, we're seeing 92% of our transmission occurring still in community settings, through community spread, and household transmission, and a small portion of that at workplaces. The good news with respect to the workplaces is they can be isolated, and we can easily do the contact tracing, close everything down, and send everyone home to self-isolate. But let me ask Dr. Lowe to address your question about inspections. Thank you, Ashley.
Thank you very much, Madam Mayor. Thanks, Ashley, for the question. And just to clarify the Mayor's stat around 90%, that refers to 90% of cases successfully traced back to a specific source within the community, and so it could be household, workplace, institutions. To your question, Ashley, in terms of workplaces, Peel Public Health has released data on occupations that are at greatest risk. We also continue to monitor outbreak investigation, and it's worth noting here as well that we have conducted over 1,000 workplace outbreak investigations since this has started. So that is a significant amount of data and a significant amount of spread that has been stopped. Out of that data, we are currently having discussions with the Ministry of Labour, Training and Skills Development, who is the provincial agency on workplace safety, around how we can start more proactive workplace blitzes in the highest risk sectors that we've identified from our data. So hopefully there'll be more workplace inspections soon to make sure that we're keeping employees safe. And I also urge employers to make sure that they are taking precautions to do so. So thank you very much for the question.
Dr. Lowe, if you just want to stay right there, your next question is from Isaac Callan from The Pointer. Isaac, please go ahead.
Hey,
Hi, Isaac. How are you?
You mentioned testing and some provincial changes to testing, and if you look at what's happened in terms of clearing the backlog, some pretty dramatic changes to who is being told that they should get a test and who isn't. While that takes time to bed in and that backlog is being cleared, are you essentially blind to the testing picture this week? Are you facing this blip of up to 7 days where you don't really know what's going on in the viral picture anymore because these administrative changes are taking place?
Isaac, it's a really great question. No, at this time we are still receiving a certain proportion of our tests within the required turnaround time. It's not that we're getting 0% of tests within 24 to 48 hours. I believe we're still getting 60 to 70%. That actually, and I would verify that just through our weekly epidemiologic summaries, because we do track that indicator. But I think the more important thing to share is that we are very fortunate because we are contact tracing, and in the course of our contact tracing, many of the tests that are delayed or coming back are usually for people who we've already identified as potential cases. And so, as I've said, Peel's picture is high in terms of its transmission, but it is also largely linked to known cases, which is why our picture and our overall approach looks different from what's happening in Toronto and Ottawa at this time. So no, we're not completely blind, but certainly I would like to see that backlog cleared sooner rather than later so that we can ensure that we are completely on top of this. Thanks for the question.
Thank you.
Next question.
Hey, Mayor Crombie. My follow-up, Mississauga Community Legal Service is presenting at the region, probably just now actually, or very soon, about evictions in Peel. And I just want to know what your position is that. Will you be lobbying the Premier to make changes either to Bill 184 or to add another eviction moratorium? Kind of what's your take on that?
Yeah, certainly. As you know, the Region of Peel council meeting will begin at about 9:30. Certainly we see that changes have been made, and we appreciate the changes that have been made, but we will be asking the Premier to extend the moratorium on evictions a little while longer while we're in the pandemic. So in the meantime, we're hoping that rents will stay low and that landlords will negotiate or, enter into discussions with their tenants with respect to payment of their, monthly rents, and that we have that moratorium, on evictions continue.
Mayor Crombie, your next question comes from Steve Cornwell from Mississauga News. Steve, please go ahead.
Hi, Mayor Crombie.
Good morning, Steve.
A question about the kind of the budget that was, previewed or discussed a bit yesterday. In terms of it seems to me like the city it has kind of put forward a lower property tax increase for residents than previously thought or previously considered, but has raised, potentially will be raising fees for recreation, fitness, other kind of services the city provides them. Are you concerned at all that kind of by preserving a lower tax rate that you might be kind of pricing out lower income folks from using the city services?
Oh, it's a very good question. So we try to keep our costs, our fees very competitive. There were instances such as the golf courses and the marinas where we were trying to be a little more competitive with the private market. And so some have modestly increased, but really only from a cost recovery standpoint. As you saw, we are today estimating a 2.7% budget increase, which would translate into a 1% tax increase to our residents. There are certain items that we feel that need to be included, including that 2% levy for debt repayment and interest repayment, and infrastructure levy that we traditionally each year put money back in our reserves to ensure that our city can continue to be very well fiscally run.
Thank you, Mayor Crombie. And just a question too, in those financial documents, we learned that the Port Credit Marina is not going to be accepted as an ISIT project funded by the provincial and federal governments.
Right.
Can you first just tell us about what this project kind of means to the city and to the area? And second, do you think it will go ahead at this point?
It's an excellent question. I'm so glad you asked that question, actually. The public marina is vital for our community, particularly the residents of Port Credit and beyond. As we know, Port Credit is a large driver for even tourism, and thousands of people come to our shoreline and the lakefront, and many enjoy boating. We have people who use that marina for their businesses, including salmon fishing, etc., and just hobby boaters. So to keep the port in in Port Credit is vital for us. The one correction I will make is that we applied for the funding under the CCR fund, the Community Culture Recreation Fund, which was the provincial fund, not the ISIP fund, and that we were declined, and we're appealing to the local MPP, Rudy Cazzetto, and our Premier. We have all spoken to the Premier about it. I certainly have in my AMO meetings, as well as one-on-one when I met with the Premier, how vital the marina is to our community. Unfortunately, it is not a project that can be debt financed from the city at this point. There are too many other budget constraints to go forward, so unless we have the assistance of the federal and the provincial government, we would be unable to build the public marina. So we are appealing to the federal and provincial Premier, to the Prime Minister, to assist us, to please, let's fulfill this legacy for our community and help us build that Port Credit public marina that is so vital to the community and to the city at large.
Mayor Crombie, your final question comes from Khaled from My Second Home TV. Khaled, please go ahead.
Mayor Crombie, how are you? Last couple of weeks, hundreds of air travelers lost their international flights because they haven't been able to get their PCR test results in a proper time. So I have a request from hundreds of people that if you can allocate one of the centers, if somebody shows a confirmed, let's say, air ticket or something, they can have their result expedited.
Yes. So thank you for the question. I will also ask Dr. Lowe to respond. And as we know, we were inviting all people to come and get tested at our assessment centers so that we could get our numbers of testing up. And then what we found is we were being inundated with people who were asymptomatic, showed no signs of COVID, who were really coming to get tested because they were taking an international flight, or perhaps they needed a good health certificate to go back to work, or perhaps they wanted to visit a loved one, a parent at a long-term care facility, or perhaps they were concerned because they came into contact with someone who had tested positive. So the test centers, the assessment centers were inundated with people who were asymptomatic, who were largely proven to be negative. So we needed to move those people out of the assessment centers, and the Premier created this program in which he moved them into private testing with our pharmacies, and we know that there are 8 pharmacies, Shoppers Drug Marts in Mississauga, 9 in Brampton, where individuals who are asymptomatic can make an appointment and go for a test. So I will let Dr. Lowe explain whether or not there are plans to put further testing for asymptomatic people back in the public program. Dr. Lowe?
Thanks so much, Mayor Crombie, and thank you, Khaled, for the question. At this time, the provincial testing criteria has changed to focus on ensuring that we are getting all we need to do to stop the spread of COVID-19. And so, as Mayor Crombie has identified, broader asymptomatic testing is now limited to specific provincial targeted testing initiatives. And so I think the question, first of all, should be directed to the province, who holds the mandate and responsibility around testing through the agency Ontario Health. And then secondly, at this time, I would remind everyone who is looking to travel that there is still a federal government advisory that advises against any non-essential travel out of Canada. So really, and everyone has a different definition of essential or non-essential. So I think it'd be very important for people to reconsider their trips in general. I think the lack of testing that is available and that is not covered through the provincial program also speaks to the fact that travel medicine is not usually an insured service under the Ontario Health Insurance Plan. And so I think it would be really important, if there are those concerns, to raise them with the provincial agency who has the mandate for testing, and to have them respond as to whether the criteria will change. But I do want to remind on the federal guidance that we're not meant to be traveling at this point in time for non-essential reasons. Thanks, Khaled, for the question.
That's the final question for today's press conference. This concludes. On behalf of Mayor Crombie, I want to thank everyone for participating. Have a good day and stay well.
Thank you.